Welcome to Registry Partners Oncology Coding Break, November 2025, Surgical Margins of the Primary Site. Our objectives today are to identify store descriptions and rationale, identify the surgical margins of primary site codes, and to provide some case examples. Surgical margins of the primary site describe the final status of the surgical margins after resection of the primary tumor. This data item is a quality measure for pathology reports, contributes to staging, and serves as a prognostic factor for recurrence risk. The surgical margin code is applied to all cases that have a surgical resection of the primary tumor. The pathology report will document the presence of microscopic or macroscopic involvement of cancer at the margins of resection. Assign the surgical margins based on the final pathology report. Codes 0 to 3 are hierarchical. If two codes describe the margin status, record the numerically higher code. Code 0 is no residual tumor and is used when the pathology report specifies that the margins are negative. This may be specified both microscopically and/or macroscopically. Code 1 is residual tumor NOS when the pathology report indicates the margins are involved but does not specify if involved microscopically or macroscopically. Code 2 is microscopic residual tumor when the pathology report indicates the margins are involved microscopically. Code 3 is macroscopic residual tumor when the pathology report indicates there are margins involved macroscopically. Code 7 is used when the pathology report indicates the margins could not be determined. Code 8 is used when surgery of primary site was not performed or the patient was diagnosed at autopsy. And Code 9 is used when it's unknown or not applicable. Record the margin status as it appears in the pathology report and always use the final diagnosis section of the pathology report for margin information. Follow the hierarchy rules. Code 7 is used only as reported on the pathology report. And if the pathology report does not mention the margin status, then Code 9 is assigned. Margin status helps determine residual disease, pathologic stage, prognostic indicators, and quality of surgical and pathology reporting. Accurate coding of surgical margins ensures the integrity of cancer registry data and supports clinical decision-making, research, and quality improvement efforts. This month's Oncology Coding Break provides several scenarios demonstrating accurate coding of surgical margins of primary site. Case example 1 is a total thyroidectomy, which is papillary carcinoma, classic subtype in the right and left lobes. Tumor size was 1.6 centimeters. The extrathyroid extension reveals that the margins are involved by the tumor. There's no microscopic extrathyroid extension noted. Carcinoma is present at the left posterior margin and is involved extensively. Surgical margins of the primary site is assigned Code 2, microscopic residual tumor. The surgical margins are positive microscopically as identified in the synopsis of the pathology report. Case example 2 is a TURP for the bladder, papillary urothelial carcinoma, non-invasive, low grade. Negative for lamina propria and muscle invasion. Muscularis propria is present in the specimen. Surgical margins of the primary site is assigned a Code 9, unknown, or not applicable. The pathology report makes no mention of margins. Case example 3 is soft tissue resection of the retroperitoneum. It measures 19 centimeters and is a well-differentiated liposarcoma, grade 1. The margin status cannot be determined. There is a further comment that states, while high-grade tumor is not identified at the excisional margins, assessment of margins of adipocytic tumors to exclude well-differentiated tumor in a setting such as this is dubious at best. Surgical margins of the primary site is assigned to code 7. Margins cannot be assessed because the pathology report states margins cannot be determined. Case example 4 is a partial distal gastrectomy, which is an adenocarcinoma moderately differentiated. The tumor penetrates subserosal connective tissue without invasion of visceral peritoneum or adjacent structures. There is tumor present at the proximal margin. The gross description states that it was received fresh for gross evaluation, labeled as distal stomach, is partial gastrectomy specimen, and tumor is seen to be present at the distal staple margin. Surgical margins of the primary site is assigned to code 3, macroscopic residual tumor. If 2 codes describe the margin status, use the numerically higher code. We have microscopic proximal margin positive, as well as in the gross description, tumor was seen at the distal staple margin. Case example 5 is a shave biopsy of the skin of the right lower back, which revealed invasive melanoma, 0.4 millimeter Breslow thickness. Peripheral surgical margins are involved in planes of sectioning. Wide local excision of the skin of the right lower back reveals no residual melanoma, but a biopsy site reaction is seen. Surgical margins of the primary site is assigned to code 9, unknown or not applicable. The wide local excision pathology report makes no mention of margins. Thank you for attending today's oncology coding break for November of 2025, surgical margins of the primary site.